Thank you so much, Dave. Really important innovations that we are seeing there that we hope will get scaled up, especially when you live in a region like this. This is important and so incredibly powerful as well. Now we have one more fascinating panel before lunch, and this one is critical. We're hearing so much about the challenges of climate change and some hints at the potential solutions in the health sector, but we can't advocate for more committed action against climate change and investment in new solutions without, of course, working together. And so our next panel will address ways that we can do that more effectively. And to lead the discussion, I'd like to introduce Dr. Jeni Miller. Dr. Miller is the Executive Director of the Global Climate and Health Alliance, where she coordinates the joint efforts of national, regional, and international health organizations addressing climate change. She co-chairs the WHO Civil Society Working Group on Climate and Health, and has extensive experience working on policy and systems change strategies to improve community environments for health, in leading initiatives addressing childhood asthma, childhood obesity, climate change, health equity, and healthy community redevelopment. Ladies and gentlemen, please welcome Dr. Jeni Miller.
Hi, everyone. It's really nice to be here. It's been such a rich discussion over the past day and a half. And I'm really excited to be here with this panel of esteemed colleagues to talk about the advocacy and policy dimension of embedding health in the climate agenda. I want to reiterate something that was mentioned in an earlier panel, which is just how extraordinary it is to have health explicitly being elevated at this COP, at COP28, with the announcement of the Health Day yesterday. It's the first time that's happened, and it's just a real opportunity for all of us. I think the question that we're going to take up in this panel as the health community, how do we not only seize this opportunity, but also embed health firmly across the climate agenda? So how do we need to align ourselves and position ourselves to influence climate decision-making? So the health community's engagement in climate change has really exploded over the past few years. Health and public health professionals have increasingly come to recognize that the climate crisis is a health emergency, is a health crisis. Just to offer one illustration of the growing interest and attention to this from the health community, a couple of years ago, ahead of COP26, health professionals came together to sign a letter to heads of state and climate negotiators at COP26. And that letter was signed on to by organizations representing 46 million health professionals around the world. That's 46 million. The Healthy Climate Prescription Letter called for many of the things that we've been talking about over the last couple of days, ranging from investment in health adaptation and in resilient health systems, to mitigation and the phase out of fossil fuels rapidly but also justly, and to integration of health across climate decision-making, really putting people at the center of climate policymaking. At the same time, we're only just starting to actually break through and penetrate the climate agenda. And as Dr. Romanello so eloquently explained yesterday, climate action remains far from on track. We're not yet on track to limit warming to 1.5 degrees. We're currently headed for 2.7 degrees, and that's not something we're going to be able to adapt to. Meanwhile, funding for adaptation for the impacts we're already seeing, as again has been discussed over the last few days, is far from where it needs to be. So what do we need to do as the health community to put people's health and well-being and equity at the center of the climate agenda? How do we become aligned, strategic, and effective at influencing climate decision-making? The Global Climate and Health Alliance, which is my professional home base, works to build capacity amongst the health community and alignment to influence climate policy making. In addition to mobilizations like the Healthy Climate Prescription, we also work with the health community ahead of every COP to prepare health professionals and health representatives that are going to COP to be ready to engage with the COP negotiations in a meaningful way and be kind of able to navigate what is, a very complex process. So if you're going to COP, or want to learn more about the UNFCCC and how to engage as a health person, we invite you to reach out to us. But while I'm very proud of the work that GCHA does, and I know that as a health community we've made great strides, we still have a really long way to go to get climate action that will fully protect people's health. So as we build the health movement on climate change, how do we do so in a way that really breaks through? So to discuss that, I'm delighted to be in conversation with my esteemed colleagues on this panel. Yacine Djibo, founder and executive director of Speak Up Africa. Zied Mhirsi, senior director of global health strategies. And Ramon San Pascual, executive director of Healthcare Without Harm, Southeast Asia. And so, just to kick us off, I'd like to ask each of you to give us a little bit of context and just tell us very briefly about the work that your organization does. Why don't I start with you, Zied?
Thank you, Jenny. At Global Health Strategies, we're basically a group of advocates that started the fight from the AIDS epidemic. I think our leaders and sort of like the senior consultants we have with us have been doing this fight for a long time. And then from there, we expanded and embraced the same tactics that we adopted for the AIDS fight into sort of other health issues. And I think we learned a lot along the way. We pride ourselves to be part of the initial group that sort of like created UHC and created the momentum around it. And then we also are very lucky to have been working here in the region with partners like the RLM on making NTDs sort of also in the advocacy movement within NTDs much larger than what it was. So we work on several issues. We're no expert in climate, and that's why I feel like very lucky that I'm with you, and I was able to learn from what you all have been doing at the last COPs. But I was also lucky to be part of my country delegation, Tunisia, at the last COP, and be present there and see how the health community is gathering and doing and pushing for policy changes. And I think there is a lot that we can all learn together in this space and benefit from other experiences as well.
Fantastic. Yacine, tell us a little bit about Speak Up Africa.
Thank you, and good morning, everyone. It's really a pleasure to be here today. Speak Up Africa is an organization that I founded more than 10 years ago, and really when I founded Speak Up Africa, it was really to be able to fill a gap that we saw in African leadership and really being able to provide solutions that were adapted to the African context and really based on the needs that were expressed by the communities, but also by the leaders themselves, and be able to develop and implement campaigns, but also solutions, and be able to support policy change at all levels for all of the issues that we work on, which primarily are health, sanitation. Like Zied, the climate space is very new to us, but at the same time, it is an area that we feel is critical to the health agenda and really feel that there's a lot that can be done. And Speak Up Africa wants to play a leading role in engaging with civil society organizations, governments, private sectors, and all the key stakeholders that we work with across the continent. Speak Up Africa is currently, well, is headquartered in Senegal, but we work across the African continent, and we've had the privilege of working with many of the partners here in the room today. And as was mentioned earlier on, we feel like partnership is critical to the work that we do. And this type of forum that brings together stakeholders from across sectors is unique in terms of really being able to ensure that we can all work together. And with COP28, there is a unique opportunity for all of us as advocates to come together and further support the work that's already being done to be able to align ourselves. And I think one of the key objectives for me today is really to be able to learn from all of you and hear what is already being done and how we can contribute to that. Thank you.
Fantastic. And Mon, a little bit about healthcare without harm.
Thank you. Good morning, everyone. Healthcare Without Harm has been in the business as an NGO. We've been doing a lot of environmental and public health work. That's how we started 27 years ago. We have offices across the globe, but our main office is in the US. We have our office in Brussels, and then I'm managing the Southeast Asia office. I've been in this work for 7 years now. That was about the time when we kicked off our global program on climate and health, acknowledging that we cannot just attend to issues, for example, of incinerating waste, of chemicals waste, of energy, without seeing it in the light of the climate crisis.
Yeah.
And at the moment, maybe 60% or 70% of our energy and resources are on climate and health. In 2019, we produced this carbon footprint of healthcare, where it was determined that if we are a country as a healthcare sector, we will be the fifth largest emitter in the world. In 2021, we followed it up with some kind of a blueprint on journeying towards zero carbon healthcare, leading up to the 2050. And we always attend as well the COP. And I'm assuring everyone here that we will be present in the COP28 as an NGO. It's a controversial discussion among colleagues in the health and climate movements. But yeah, I can share later on what else are we doing, particularly in my part of the world. Thank you, Jeni.
Yeah, wonderful. Well, so I'd like to kick off the discussion by asking Yacine and Zied to speak about this question. The health community has important advocacy experience, as you were referring to, Zied, ranging from malaria to addressing HIV and AIDS, to the work of physicians on nuclear war, to the Framework Convention on Tobacco Control. How can we bring those lessons from the health community into this big fight to address climate change and turn the climate agenda toward protecting health? What can we learn from those experiences?
Thank you, Jeni. I totally agree. I think that basically the health movement has a lot of lessons learned, and we have been able in the last 30, 40 years to fight many battles. Being a medical student myself as part of the IFMSA network, I remember us being enlisted very early on in the fight against nuclear war. And I think these are inspiring movements that you refer to, the same thing with the AIDS epidemic. But also more recently with COVID. We've seen the health advocacy space move very quickly. I think we're able as health advocates to learn about the issues very quickly. And I feel like a lot of people are overwhelmed with basically the amount of learnings they need to do around climate. But I have faith that we're able to do it very quickly. And I remember Dr. Mazen yesterday from WHO asking for more advocates in this space. So I think the advocacy movement is embracing now climate. And I think with an organization like yours, we're able to learn things very quickly. But I think in many ways, the ingredients are fairly the same. It is about science-based or evidence-based advocacy. It is, the data is there. We heard Dr. Romanello yesterday. We've seen a lot of briefs coming from WHO. We've seen a lot of documents on what needs to be done. I think our role is to kind of embrace that and socialize it as much as we can. I think building partnerships across sectors is a key issue. I think if we're gonna lead this fight alone as the health movement, it's gonna take us many years. If we embrace a cross-sectoral approach and bring people along, I think we can accelerate the evolution of the movement very quickly. So clearly, building partnerships is key in this fight. And I think we're very lucky that we have COP happening every year. I think in many ways we didn't have that in other disease areas when we sort of have had to start things from scratch. Here we have a UN moment for 2 weeks where all the heads of states are there, where there is a global movement advocating for climate, and it is about us sort of like becoming and embracing this community and joining the fight. So as much as we also want to socialize the health component of the climate agenda, we want to also be part of decarbonization, about the race to zero, about the bigger fights that are out there, and show that the health community is joining the global fight.
Yeah, I think that's very important, connecting across the climate and health, connecting with the climate community. Yacine, I know you've been working to engage youth in some of the work that you do. What are some of the lessons that you can take from the work that you've done and the work that you are doing that we could bring to the climate and health effort?
So maybe just first to add on to what Zied was saying, I totally agree with the importance of partnership, multi-sectoral collaboration. And I think one approach, at least at country level, is the One Health approach that is increasingly becoming an initiative that different stakeholders working around health outcomes, both from a human health perspective, an animal health perspective, as well as climate and environmental, can come together and work on several policies and really be able to work on programs and legislations together. And in Senegal, in 2017, they actually established a secretariat that's directly linked to the Prime Minister's office to really be able to manage and coordinate this effort. It's still an effort that is to be worked on, but certainly one, I think, that could be an important one for countries that have already established this type of a platform to really be able to engage on. I think from a country perspective still, I was very inspired this morning around the intervention of our youth champions, and really want to commend you all for the tremendous work that you're doing in your advocacy efforts. And this is an area where I think we really need to ensure at all levels that we are creating those spaces for the youth voices. But most importantly, as was mentioned in the recommendations, that we're providing the funding, that we're providing the capacity support that they need, that we're providing mentorship and leadership. And one of the initiatives that we recently launched with support from Reaching the Last Mile is the Young Leadership Initiative. As it stands now, very much focused on neglected tropical diseases, but really building on those components that I just mentioned. And as I was listening this morning, I was thinking about how do we make the link between the work of those youth leaders with the work that's being done at regional and global level, and how do we bring in the health and climate agendas and use this opportunity to pilot further what that looks like at country level. Because one of my questions as I think about climate and health is really practically at a country level, if you want to engage with the communities and the youth and the civil society organizations, how are you able to translate the global agenda into action? And this is an area that we're very passionate about and really want to continue to play the role that we're already playing with engaging with these groups that are traditionally left out. And that would be maybe something that I would say we learned from our work in global health, is that even though we've done so much, this is something where we're playing catch up now in terms of really engaging meaningfully youth and civil society and communities. So this would be maybe one area. And maybe at a global level, the example I want to talk about is some of the campaigns we've worked on. And I know my colleagues from Malaria No More UK, who have done a lot of the work around the Zero Malaria campaign at a global level, have worked with the RBM partnership and many of us to build on a grassroots campaign that started in Senegal into a global movement, but that really brings together all of the stakeholders across the world, across the community, to be able to build political commitment and political will, to be able to get domestic resources, to be able to get donor resources, to be able to ensure that malaria continues to be prioritized. And I think learning from campaigns like that one and adapting it potentially to a common campaign between the health and climate communities ahead of COP28 could be also a good way of ensuring that this conversation we're having here goes beyond this room and is able to really touch not only the citizens who we know are very affected by and advocate strongly for climate action, but most importantly for the decision makers in the climate change space to be able to meaningfully include health as a priority and to fund it. Thank you.
Yeah, thanks. Yeah, really some extraordinary examples and experiences from within the global health space of mobilizing from local to global levels and across different areas of action. So turning to a little bit of a different question now. So we were reminded yesterday that at COP26, a number of countries made commitments to invest in resilient, low-carbon health systems in what is now called the ATTACH program, the Alliance for Transformative Action on Climate and Health. With this in mind and the work that Healthcare Without Harm does, Mon, how can the health sector and the healthcare sector play a leadership role in addressing the climate crisis? And what does that look like in countries and internationally?
Yeah, I wish I can answer your earlier question, but let me answer your question. I have something to share about it, maybe if we have the time. Now, as to the work of the ATTACH and our engagement with it, as much as our engagement with our alliance among the NGOs doing health and climate. The healthcare sector can lead in three ways. One, to attend to the very needs and sustainability goals set up by the hospitals and the facilities themselves. The only way that the doctors, nurses, the engineers, the waste people inside the hospital can talk about it is to showcase it in their own facilities. That's a very explicit and necessary form of leadership. But more than that, apart from reducing your waste volume, trying to manage your plastic waste inside the hospitals like the PPEs, beyond that, there has to be an engagement at the policy level. This can be with the Ministry of Health, or we call it in our country the Department of Health. This can be with the local government unit, or with the town or city mayors. But definitely, there is a need to break the silo that corner, at one instance, the health sector and excluding it from the others. That articulation should come from us in the healthcare sector. That's the second. And all this should be towards building resilience, as well as reducing the carbon footprint inside hospitals and relating it with the bigger policy in the municipality or at the national level. But the third level of leadership, I would think, Jeni, and this is where the global climate agenda becomes critical. We cannot just see ourselves as climate and health advocates and activists. We are part of a global movement. to, to fight and address climate change. And therefore, we cannot wait until a year, 2 years, 3 years down the line when we should begin asking other sectors, what are they doing? We are part of the Race to Zero. Healthcare Without Harm is the NGO partner of the UNFCCC on the Race to Zero initiative. It's a global movement. But I haven't heard since we took that assignment of any work that would integrate the healthcare Race to Zero with that of the banking Race to Zero, with the agriculture Race to Zero, with the energy Race to Zero, and speaking up, not even in the locality, not even at the country level, much more at the region level. So we can be attached on our own work, but we should not. That is the third level of leadership that we should exercise. We break out away from our silos and talk with other key sectors and key leaders across the country and the global community.
Great. So I'm curious about, you wanted to jump in on one of the other questions. What did you want to add?
Yeah.
Please.
When Zied and I were classmates, we were together in the same public health school in the University of Washington. We were a product of the UW. When we were there around 2007, 2006, the global health struggle was on acknowledging the rights of women to their reproductive health and rights. And I was in a very Catholic country. And that was the fight that we fought for a good 12 years until I became an international NGO worker, until we won the reproductive health law. It is not just a policy that we change. It is the culture, it is the consciousness, it is the awareness of people that women's health is crucial in defending the family, in defending the workplace, in defending the youth, and defending the overall public health. Whereas 11 mothers were dying every day during that time in our country due to the lack of maternal health services. And finally, despite the opposition, that despite the cultural struggle that we went through, we won that over, and we think that it has become a good vehicle to educate, to view culture in a different way, and now we're implementing the law. And we're about to reap what we call as the demographic dividend out of that law. So that's how I see the whole work that we're doing on climate and health.
Yeah. So Zied or Yacine, anything you'd like to add about the importance of engaging across sectors, or this additional element that Mon just mentioned about the need to kind of effect a cultural change in order to see the kinds of changes that we're aiming for? Any additional thoughts about either of those things?
Well, we're both Africans. I'm from North Africa. She's from West Africa. And applying your question to the African continent makes it even more interesting.
Yeah.
I think when it comes to leadership on climate issues, we haven't seen this issue come at the forefront of the African Union meetings or the heads of states committing. If I ask the room, who is the African head of states that you know of as a climate champion, you might not think about more than one. So I think it's, for us, the leadership battle is a real battle. And I'm very energized about what happened at a hike 2 weeks ago, where we've seen a conference, a public health conference that's mainly built around the health agenda in Africa, prioritizing climate. I'm very excited to have also listened to Martin yesterday speak about the work they do. So yeah, I think in many ways the leadership fight we have to lead in Africa and the rest of the world is crucial, because in many ways the last COP happened on the African continent, and it was an initiation for a lot of us on how we go to these conferences and how we sort of set a list of agenda issues that we want to tackle, and how to equip our heads of states to speak on the issues. But then, yeah, now that we have sort of the fund established, we can actually see a glimpse of light in terms of the resources that's going to be mobilized, and potentially that's going to boost the leadership conversation on the African continent. But in my opinion, this is something that we have to lead from the ground up, and I'll let Yacine talk about the community. She's more equipped than that. But our level, we definitely want to see strong and continuous commitment. We know that the Kenyan leadership is planning on leading consultations ahead of COP. We also know that this is on the level of our region, in the Middle East and North Africa as well. We're going to have a regional MENA Climate Week. Those are moments where we need to kind of equip our leader to be ready to go on the global stage, particularly that in terms of plans that are adopted, particularly around things that need to happen on sort of like on the national level. We already sort of like starting to see glimpses of that. Now it's all about mobilizing resources, making sure it is sort of like established at the national level, and that we can continue working on this.
Yes, I agree with Zied. I think this is really an issue that we need to have prioritized at the highest levels of leadership, whether it's at the continental level with the African Union, but also at the regional level with the economic blocs, and then at country level. It's true that this is a global agenda and has a lot of visibility on the global stages, but then when you go in countries, at least as Zied was saying, in some of our countries, it's not as prioritized as we would want them to be. And I think as a global community of advocates, we do have a big role to play. And certainly, I also echo Zied's comments with respect to AMREF and the leadership role they're playing on the continent with respect to the health and climate agenda. It is in large part thanks to their efforts that many countries and organizations in Africa are now looking at that direct link between the two and championing this joint agenda. But I do agree also that, you know, we do have to go beyond just the health and climate and really look at how we can advocate more holistically, knowing sometimes the challenges with that as well, for working, you know, on many multiple issues, even across some of the issues that have direct links. We very much operate in silos. So again, I think to echo also another comment made this morning, how do we break those silos? How do we have a narrative where, you know, presidents and heads of states who have all of these priorities can engage and see the health and well-being of their communities and not necessarily engage on one versus the other issues. So I think this is one of the challenges as well as a global community that we need to look into. And finally, I think at the, you know, more community level and working with local authorities and, you know, partners, how do we translate this discourse into the languages that are adapted to them and that they're able to realistically understand and see what we're trying to talk about. So I think it's really looking at it from several levels, but at least in Africa where, you know, we're the most affected by some of these issues we're talking about, there isn't that knowledge and even understanding sometimes of the issue itself and what can be done.
Yeah, that's a really good segue to the next question that I want to ask about, which is that, you know, when I think about embedding health in the climate agenda or reaching into and moving the climate agenda, there are a couple of key kind of sets of, you know, audience or stakeholders that I have in mind. And one of those, of course, is policymakers. I'll ask about that in a minute. But the other is kind of community members, citizens, you know, the public. And we've seen that public acceptance of or rejection of climate-oriented policies can make a huge difference in whether they're successful. And the community can actually push for some of the change that's needed. So how do we, you know, what's needed in order to bring health into the climate agenda for the general community and the, you know, community members, the public, the general population? Yeah, Mon.
Yeah, I think this is a timely question now that we're marching towards COP28. That the biggest threat to our health, to everyone's health, is the fossil fuel. that is triggering and accelerating the climate change, and that provides further fuel into adverse impacts on health, on people, as well as on the environment. And even before looking into the role of the hospital, in the public health, we always say that the health is generated within the very household and within the very community. And therefore, what we must have is an environmental health that is free from levels of pollution. And the biggest pollutant is coming up from the products of the fossil fuel. And that includes plastics, by the way, which we are all using anyway from sunrise to sunset until we sleep. We are all fascinated by all our plastic consumables and plastic equipment and devices. But think of it, how best do we promote public health and community health at this point in time of the climate crisis? It is by addressing the very core where the threat on health is coming up from, which is fossil fuel. And now, as for the role of the hospitals, in healthcare without harm, because hospitals is part of a community. You find whether it is a community hospital, a tertiary hospital, a specialty hospital, it's always in a setting of community. And therefore, what we can consider as a resilient healthcare would also mean creating an anchor for resilient community. And this is, again, a responsibility that we owe to ourselves as healthcare advocates, practitioners, clinicians, that when we speak of health and climate and we speak of resilience, therefore, it also means that we take care both of the facility, the minds and the capacity of the people, and as well as the very community where you work and where that hospital resides. So the whole notion of community resilience, I would say, and I would argue at the core of it, is the whole issue of health.
Yacine, yeah.
So maybe just from another perspective, I think for some of the work we've done around malaria, and the PMI coordinator alluded to seasonal malaria chemoprevention as being one of the preventive methods. We worked on that project for 3 years when it first was being implemented. And one of the things that was fascinating was really the work that had to be done at the community level to be able to get the acceptance to take medication for a disease you did not have. And so, you know, given that in the case of SMC, it's directly linked, you know, to climate and the rainy season, it was also an opportunity to use it as an example of a program that directly linked malaria with climate change, and really being able to have community understand, accept, and then demand. And I think, as was also mentioned this morning, you know, with vaccines, it's also the same process whereby, you know, as we work on these innovations and really try and scale them up, it is critical at the end that the community be at the center, that they demand these innovations so that we're able to get that. And that's a lot of the work that we do, is really to be able to build that community demand and really community acceptance, but also be able to engage them in the policies and in the legislations that are needed at their level as well, to be able to receive these innovations when they do come.
So say a little bit more about, like, how do you actually do that? Like, how do you work with communities in that way and bring them along to understand legislation or policies that are coming up, and to understand why it matters? And like concretely, what does that look like?
So concretely, what it looks like first and foremost is working with the national programs, whether it's the NTD program, the malaria program. And this is also, you know, an area where I think there's a lot that we can do in terms of ensuring that climate change is included in the health policies and strategies. I know here we're talking about how to include health in the climate agenda, but I also think we need to include the climate agenda into the health agenda. And one very practical way a lot of us can do that is to support national programs integrating those elements into their strategies. So our starting point usually is the National Strategic Plan, whether it's malaria or NTDs or any of the issues that we work on. And then as part of that process, you have engagement from all stakeholders. And then when it's time for implementation, then you go to the community level or the subnational level, where you work with the subnational medical teams and stakeholders and civil society organizations to be able to implement or a program or deliver an MDA or that type of thing. And there it's sensitizations with religious leaders, sensitizations with elected officials, sensitizations with the communities. It's also ensuring that at that local level also the policies are adapted to the needs of the program that is to be implemented. And then in many cases what we also do is accompany that with a campaign whereby we use media, we use champions, we use influencers from the community, but also beyond, depending on who that community is most receptive to in terms of messaging, and then develop that on an ongoing basis to be able to ensure that systematically those programs are being implemented, and that if there is some misinformation or some additional advocacy that needs to be done, that the mechanisms are put in place to be able to support those organizations. And maybe a last way in which, and I alluded to this a little earlier on, that we engage with is through civil society organizations and youth-led groups. So the idea with them particularly is to, one, get them to participate in the strategic planning process, but then work on their own plans in terms of the work that they do on a daily basis so that they can hold the governments accountable, they can sensitize the communities as needed, and then they can also re-engage at the higher levels as needed.
Yeah, in the climate movement, the youth movement for climate change have been so powerful and so influential, and I think there's an emerging and growing youth health and climate movement. So, yeah, Mon, you wanted to jump in.
Yeah, two examples on your question of how is it done with the community. There is this Kotik Puat Hospital in northern part of the city of Singapore, which is called as the park within a hospital and a hospital within a park. It is a truly, literally, a green hospital. And there are several features of it apart from the design, the energy use, the waste management, how they make use of the rainwaters. But one feature of that hospital that I've been so impressed is the food that they grow on the rooftop in an amount that they're able to sell it on affordable prices to the community on a daily basis, at the same time that they're able to cook and feed it to their patients and to the guests that come into the hospital. Now, the community's engagement in that regard is that they are the volunteers who provide the time to ensure that the rooftop garden, both fruits and vegetables, not only vegetables but also fruits, are being attended to by making their time available. And these are the community people. But at the same time, it is the community that are benefiting from it because every day at the premises of the hospital, they're able to purchase fresh, green fruits and vegetables. Or they can go to the cafeteria and be able to take a good taste of the different food that are sold out of that garden. So in a small way, what we call a sustainable procurement and production in hospitals is happening in Singapore, in this hospital, but it's also being done in many already healthcare systems in the US. But I would not talk about that. I want to talk about the second situation. Okay. Recently, a carrier, an oil carrier that has this diesel oil on it, moving from one island to the next in our country, had a problem, and it spilled the 400,000 liters of oil into the ocean. Wow. It's still going on. And we are an island, we are an archipelago, where people rely so much, whether on tourism or catching the products from the sea, and other livelihood that it's coming up from the ocean and the waters. And all these are threatened now. Now, there was a call among NGOs, we should discuss this. And we were called, how do we assess the health impact of this oil spill into the community and into the environment? But our notion of it is much higher than that. How can we avoid oil spill in the first place? By, again, addressing our own addiction to fossil fuel. There could be other ways. And this has now become a larger discussion. But we can relate our issues with that of how community do suffer or how community do benefit.
Yeah, and I think one of the things that I like about the example that you just mentioned is, it's very easy when thinking about climate change and working on climate change and health to become very caught up with the crisis dimension of it and the catastrophe dimension of it. But we also know that addressing climate change, doing the things we need to do to address climate change can bring tremendous benefits for health. And the example of the community garden, and engaging with the community around a positive solution is really powerful, while at the same time still, being ready to tackle those kind of harder issues like phasing out fossil fuels, which we know we need to do in order to protect health. So I think we need both that kind of vision for a positive direction and the willingness to take on the hard challenges. So Zied, turning now from kind of the engagement of the general public and communities, let's talk a little bit about kind of the global climate processes and the COPs. What are some examples of wins? You were at COP27. What are some examples of wins for health that the health community achieved at COP27? And a question for you, and then for the others if you wish to answer as well. What should the health community be calling for within the climate negotiations going forward and at COP28? What should we be asking for, and how should we be engaging there?
Well, I think this is the question everybody's trying to kind of think about. We're all here talking about COP28, we're all here strategizing, but I think we're still sort of like trying to kind of have a common agenda. And I think conferences like this and venues and forums like the ones that are going to happen in the next months are going to be crucial. I believe first and foremost that we need to be celebrating what happened at COP27. The Loss and Damage Fund is a major win. I mean, to be honest, I was there and I was seeing a lot of people feeling so desperate, thinking that's not going to happen. And we've seen the community come together and people mobilizing up to the last minutes and staying up late at night. And I think that sort of energy is what is needed to kind of like be able to make a difference. We've seen a mention of health in the sort of like text. We've seen that now sort of like other sectors are starting to pay attention. In many ways, I believe that the COP27 was sort of like setting the stage for what this COP could be like. We've seen a very beautiful and crowded WHO pavilion. We've seen people gather around that. We've seen private sector presence and commitment to health issues. We've seen a lot of people also starting to realize that basically the health sort of agenda has to be synced with what is being negotiated. And I think a lot of people, as much as we're going to learn on these conferences about the impact of health, I think ultimately the negotiation, and you go there and sit down for hours and you don't hear the word health. Yeah. You're like, what am I doing here? But understanding what the adaptation and mitigation conversations are about, trying to kind of like see where we can have a breakthrough or a crack in sort of like the wall to kind of squeeze in a health priority. I think that is sort of like how COP shape up. I believe before we get to COP, it is very important to strengthen the climate discussion within WHO. WHO is an organization that sort of like help us coordinate a lot of the sort of public health order that we're discussing these days, and the institution that were strengthened by WHO through their impact on national and regional sort of policy is crucial. So without a strong WHO, I don't think we could be strong at COP. So my hope is that we could see resolutions at the next WHA. We know there won't be, but we need to kind of keep the pressure. We need to kind of like make sure that in May in Geneva, every single minister of health has a list of the investment that they want to see in terms of climate and health. So when they come to COP for Health Day, we have a common voice. And I feel it's very important that we sort of like maintain momentum throughout the year. So yes, COP is a moment that I believe, is going to be a game changer in terms of health and climate, but I think the roadmap and the road to COP is as important in order to secure a successful COP. So I think, as I'm seeing a lot of the funders here in the room, investments in sort of like helping the advocacy space. We're investing a lot in generating data, but I think we mentioned it right now with Yacine, the importance of messaging, the importance of knowing exactly what we're fighting for and how to message it properly so it can translate outside the health space. And I think this is something that it doesn't come overnight. So I think in many ways, it needs its own sort of like investment and follow-up and building a core group. And we've seen with the youth movement, like a lot of the negotiators staying up to 3, 4 a.m. are actually young people who are sort of pushing the agenda and equipping them with what needs to happen and sort of like trying to kind of make sure that in COP, at the next one, when we sort of like go there, the stock-taking report is out, the WHO sort of briefing notes are gonna be out. It's about how much we're gonna embrace them, how much we're gonna know what we're fighting for. So yeah, I think basically this is an ongoing battle, and the numbers are increasing, but not enough. So let's keep it up.
Yeah.
So maybe just a few additional thoughts. A lot of the ones I had you covered, but for me, I think it'll be critical to have African leadership from head of state to civil society to private sector to youth, and really be able to ensure that they own the health agenda within the climate agenda ahead of COP28. And a lot of the work that, I'm hoping that we'll be able to collectively do together is really to be able to support that leadership in the next few months in the lead up to COP28. So that would really be, for me, what I would like to see at COP28. And also, being able, as I mentioned earlier on, work as a global community potentially on a campaign that would allow us to really be able to build that movement in support of the Global Health Day within COP28. And really, I feel like with the UAE hosting and having made that commitment, it is up to all of us to also see how we can come and be able to propose those big ideas that Tala asked us to be able to bring to the table, celebrate the progress that has been done, but also a lot of the innovations that we have been hearing about, and being able to ensure that the investments that are needed are mobilized, because at the end of the day, that is, at least for me, the biggest challenge that we have, is really ensuring that we have that additional investment in health within the climate agenda.
Yeah, three things, Jenny and colleagues. If we will have this health day, and indeed we will have it in November here in United Arab Emirates during the COP28, I think one key message should ring through that entire day and the entire COP. The very cost that is hurting people's health and public health is that generated by the climate crisis. And that is coming up from one key source, the fossil fuel. We should speak about it. I think this is the opportunity provided for by the fact that we are being hosted by the United Arab Emirates. And in so doing, in making it a clear, out loud, consistent message throughout, how do we work around it? What are the alternatives? What is the role of the healthcare? How do we work with other sectors? So the second part there should be now to showcase what healthcare can actually do and has been doing in terms of reducing climate emission in their own healthcare facilities. We already have the blueprint. We have now the tool. We have the cloud where we put all the data across hospitals. This is the checkup tool. And MOH, Department of Health, all over are asking how we can utilize it. I think we should be both proud and humble of the effort that the healthcare sector is doing. For all the, whether we are late or we are on time, but we just have to register it. What do we actually do in our own healthcare facilities and healthcare systems? And third, we should invite other sectors to dialogue with us. This is now my third climate and health conference. From the One Health conference in Singapore in November, the PMAC conference in Bangkok in January, and now here, Forecasting Healthy Futures. And we're very pleasantly surprised that every time they're putting climate and health at the center of it. However, in the next climate and health meetings, we should have other sectors as well. Whether we listen to them, they listen to us, but we must dialogue. If only to see that the whole problem of climate crisis is not only a crisis of health. It is societal, it is transcendental. So I think that's the third opportunity being provided for by the COP.
Yeah. Yeah, so I think we need to wrap up here, but I think a key takeaway here is that what we really need to see are quite transformational changes across many sectors and many systems. And to achieve those transformational changes, we need to be organizing and drawing on those lessons from our history in global health. We also need to be working across sectors. And we need to inform ourselves about the climate policymaking processes so that when we go to a COP or go to national government and try to engage, we're really informed and speaking the right language and bringing putting our best foot forward to try to make the case for why health is an important component and really should be at the center of this work. So I'm really excited, actually, that there are folks on the panel that joined me here that are new to the climate conversation, because we need to keep growing the health community's involvement on climate change. And I think working together, we can really make a difference. Thank you all.
Thank you, Jenny.
Thank you so much, Jenny, and the panelists, for